Hi everyone, my name is Katie Berry and I'm a Global Health Student Consultant. Today I'm going to present some ideas and recommendations for a quality improvement initiative for the NGO Treatment for All in Guinea. But first, let me tell you a little bit about my experience and qualifications. I'm a graduate student at Boston University School of Public Health who is currently studying global health and who dreams of becoming a full-time consultant. I have experience working in global health projects related to human resources, financial management, program design, mHealth, information management, and quality improvement. I excel at generating new ideas, collaborating with partners, planning for long-term success, leading and managing teams, solving challenges, and creatively presenting results. My new client, Treatment for All, aims to build public and private sector capacity for the clinical care and treatment of individuals living with HIV/AIDS. TFA is funded chiefly by the President's Emergency Plan for AIDS Relief, or PEPFAR. Through a variety of programs and partnerships, TFA supports over 170 sites across Guinea. The Total Life Clinic is TFA's flagship ART clinic in Conakry. Situated in a large public hospital, it provides care to approximately 18,000 patients on ART, which translates to approximately 179 medical visits per day, plus an additional 177 non-medical pharmacy visits. There is rising concern that this large and growing number of patient visits is overwhelming the clinic. Additionally, patients are waiting a long time to see a physician. On average, patients spend 4 hours and 29 minutes at the clinic for a medical visit and 2 hours and 25 minutes for a pharmacy visit. In addition, laboratory tests can add up to 6 hours to the total visit length. Despite these long wait times, on average, patients only spend 13 minutes with a physician. My preliminary analysis of the situation reveals two primary problems. First, the appointment scheduling at the clinic is unbalanced and ineffective. The clinic schedules appointments between 8 a.m. and 12:30 p.m. However, 86% of all patients arrive before 9:30, which contributes to long wait times. Second, the current system includes a complicated multi-step registration process, and there are often long queues and wait times between steps. To fix these problems, the Total Life Clinic must schedule patients more evenly throughout the day in order to level entry into the patient pathways. Additionally, the clinic should streamline and standardize these patient pathways by eliminating waste and reducing bottlenecks. I've developed a 6-step consulting plan that I will execute upon arrival in Conakry to support these solutions. After meeting with senior management and providing an introduction to quality improvement and lean management techniques, I will form a quality improvement team of doctors, nurses, and staff. This team will help me plan, develop, and implement improvements to patient scheduling and flow at the clinic. Next, I will need to assess the situation with my own eyes in order to visualize and understand the challenges. The QI team and I will follow actual patients through their visits and document the process. We will gather additional information by holding focus group discussions, assessing the scheduling process, and creating a task log for clinic staff. After gathering all necessary information, we will identify and analyze key stages in the patient flows, classifying each step as adding value or waste. This will help the team identify bottlenecks in the process and set targets for improvement. After developing a value stream map of the current process, the QI team will eliminate waste and delays between steps and optimize the performance of value-added steps. We will then develop a finalized value stream map that depicts the ideal future state. Next, we will present recommendations to the senior TFA staff. Then, I will lead a training on the improved scheduling, registration, and treatment procedures for the clinic staff who will implement the changes. Finally, we will evaluate the success of the changes by implementing a patient exit survey, reassessing the timing of patient pathways, and developing a follow-up plan for senior management. To facilitate this process, I will lead the QI team in producing the following deliverables: an introductory presentation on quality improvement, scripts for focus group discussions, a task log for staff, value stream maps of current and future states, a training manual on new procedures, a patient exit survey, and a plan to monitor success. The primary challenges we will encounter include ensuring that there is sufficient staff buy-in to support changes, identifying a funding source, and planning for sustainability and long-term success. However, involving local staff early on will help us overcome these challenges and make the changes with a lasting impact. Thanks for checking out my video consulting plan for a quality improvement initiative for the Treatment for All organization in Guinea. If you have any questions about my recommendations, please feel free to email me at the address below. Thanks again for watching. Have a great day.